Hi, my name is Maddie Rogg, and I'm doing my monograph on asthma. I'm a second year nursing student, and I'm looking to go into either pediatrics or OB. There were many reasons why I chose to do my monograph on asthma. The main one being that asthma is the most common childhood chronic disease, and it's something that I've seen very frequently in the hospital. It affects millions of children and adults throughout their lives. Something not as well known about asthma is that it can leave and return, and that asthma symptoms can change over time. The number of people affected by asthma has also been growing each year, and this can be attributed to many different environmental factors and pollutions. Populations who struggle controlling their asthma symptoms can die from an asthma attack. Nurses can also aid patients in making asthma action plans that can help to manage these symptoms and the attacks. The patient that sparked my interest on asthma was an adolescent patient who came into the ER for a severe asthma attack. He was an adolescent patient who was unaware that he had asthma and believed his symptoms to just be from bad allergies. He had been tested before for asthma, but at the time, he did not meet the criteria to get a diagnosis. He was suffering from daily chest tightness, shortness of breath, coughing, and wheezing, which was aggravated during the fall and spring and especially while playing sports. He had been taking Claritin, antihistamines, decongestants, and anti inflammatory over the counter medications, which were not helping his symptoms. During a soccer game, it became so difficult for him to breathe that he was taken to the ER. Upon assessment, he was found to have severe shortness of breath, chest tightness, wheezing on exhale, an SpO2 of 87%, a respiratory rate of 32 per minute, a heart rate of 126 per minute, the use of accessory respiratory muscles, and a blood pressure of 134 over 87. My recommendation would be that this patient needs oxygen and a nebulizer treatment of a bronchodilator such as albuterol. This patient should also be practicing using the incentive spirometer, and once stable, this patient needs education on asthma, how to use an inhaler, to be prescribed an inhaler, and to make an asthma action plan. Here is some background information on asthma. The pathophysiology of asthma affects everybody differently, but it is a combination of airway inflammation, intermittent airflow obstruction and narrowing, and bronchial hyperresponsiveness, and they're all playing a role in the severity of the symptoms and attacks, which are individualized per the patient. Risk factors that can increase these symptoms and attacks and your likeliness to have asthma would be a parent or sibling with asthma, having a severe respiratory infection as a child, having bad allergies, or being exposed to certain chemical irritants or industrial dusts. The current practice for asthma is to be treated with rescue and controller inhalers. There are both short and long acting bronchodilation inhalers available to help treat and prevent the symptoms and attacks of asthma. The use of incentive spirometry and the development of an asthma action plan is also often included in asthma education programs. The first article I chose was on the effect of goal setting in asthma self management education. This article's aim was to systematically integrate evidence for effectiveness of goal setting interventions on asthma outcomes for all ages and between both male and female patients. This study did have a bigger focus on children, but adults were included as well. These authors pulled from over 2,000 records from international medical databases from 6 different countries, including the US, to evaluate the methods of asthma education being given in hospitals all over the world. They had to screen through thousands more in order to find records that met the criteria of education to asthma that would be applicable to their study. Their data analysis compared patients given no goal setting and basic asthma education, patients given basic asthma education and goal setting by either a pharmacist or a nurse, but without being checked in on, and basic education with goal setting with additional checkups to evaluate their goals and symptoms. This would be like having a follow up doctor's appointment with either a nurse or a doctor that would be about 10 minutes and about a month apart. Goal setting would be done by the patient and the nurse if the patient was an adult, and if the patient was a child and unable to realistically set goals for themselves, The patient and the parents, as well as the nurse, would set the goals together. By setting goals to manage asthmatic symptoms and goals to limit or prevent any asthma attacks, the theory is that this will increase the patient's motivation and awareness to achieve these goals, thus improving the asthma action plan in its entirety. Most goals that were set fell into three main categories: either managing asthma triggers, achieving asthma control, and properly using medication to prevent asthma attacks. They found that statistically significant data on patients who had previously rated their asthma as severe then rated them as either moderate or mild after sticking with their goals. This rating is related to the severity of symptoms and the interference of asthma in daily life. There appears to be evidence base to support the effectiveness of goal setting interventions in improving asthma control, quality of life, and self efficacy in asthmatic patients. How this connects to my patient. So, this study shows that setting goals can greatly reduce the amount of interference and symptoms of asthma in daily life when they are achieved. This evidence based practice can be integrated into patient education and specifically could help my patient regain his ability to play sports without asthma attacks or suffering from severe asthma symptoms. Two areas of research that I think should continue coming off of this article would be to compare the effectiveness of goal setting in outpatient and inpatient settings, and to compare the influence of checking in with a medical professional on progress towards achieving your goals. The second article that I chose to review was School Nurses' Available Education to Manage Children with Asthma at School. This article compared levels of school nurse education required and provided on asthma symptom management and asthma attack treatment. Their study collected data on the training and past education of school nurses and their ability to apply evidence-based practice to manage asthma in a school setting. These nurses were taking care of children aged 5 to 19, so mostly elementary school and high school level education in public schools. They surveyed the nurses and found that most of them had associate's degrees, while some of them did have their BSN. So they focused their study on the education and training the school provided for the nurse upon being hired. Comparing the different levels of expectations of asthma education programs among over 2,000 school nurses provided by the schools themselves showed significant curves in both confidence and knowledge among the school nurses. 70% of the school nurses were chosen from U.S. schools, and 30% were chosen from schools in Taiwan. Many of these schools offered a program every 6 months for the nurses to attend to retrain them and on most of the common issues, including asthma, within their school, but most of the schools did not offer such a program. This study found significant gaps and a lack of consistency among schools, as well as insufficient asthma education programs available to nurses. 70% of the nurses had never seen a peak flow meter. 80% of them had never participated in any asthma education program in the past 6 months. 51% reported a lack of available training or education for the nurses themselves, and 25% of the nurses admitted that they were not aware or did not have any emergency action plan for asthma attacks for the children in the school. How this connects to my patient. So my patient was in contact with coaches, an athletic director, and the school nurse who treated his symptoms as allergies since he did not previously know that he had asthma. If the school nurse was trained in asthma management, she may have been able to better recognize the condition and suggest that he see a doctor for diagnosis, which would have prevented his severe asthma attack that brought him into the ER in the first place. Two areas of research to continue. The level of education given towards asthma in nursing schools, regardless of the nurse's plan for after the school. And I think that looking into the health education provided to the students and what that includes could also be very helpful. Benefits to my patient from evidence-based practice. We used evidence-based practice in this patient's care by not only teaching the patient, but also his family the factors that could exacerbate his asthmatic symptoms. We also taught him and his family how to properly use the inhaler and created the action plan together, while using goal-setting techniques so that he would have a support system to turn to if he got into a situation where he could not treat himself. We wrote up this action plan and sent it with him so that his school nurse could be informed and aware of his condition. We requested the school nurse and the patient both communicate with the coach and the athletic director of his school so that they would be aware and could also carry extra inhalers with them during games. We set goals to manage his symptoms and will adjust his doses and frequency of using his inhaler to ensure that his symptoms are managed and no further attacks occur. In conclusion, it's very important that people be aware that just because they have not had asthma throughout their lives, it doesn't mean that they can't develop it and that it can come and go at any point. Setting goals and making an action plan is the best way to manage symptoms and to prevent asthma attacks. Being educated as the patient, as well as having your friends and family aware of your condition and what to do, can save your life. Using resources such as a school nurse, professors, coaches, and athletic directors can help you stick to your action plan. And having a formal education as a school nurse can benefit all students diagnosed and those who are not yet aware that they may have asthma.